Hello again, Toby Goller here from Rochester, Minnesota with a Mayo Clinic Men's Health Moment. Today we're going to cover erectile dysfunction. It predicts heart attacks. Previous videos we talked about risk factors for erectile dysfunction. Today I want to focus on a very specific one, heart disease or clogged blood vessels, otherwise known as atherosclerosis. When we start to carefully examine the anatomy of both the penis and the heart, we can see how these processes are interrelated. Here's a picture of a man's blood vessels that are exaggerated. You can see that the penile blood vessels are 1 to 2 millimeters, and the coronary vessels, or the ones in the heart, are 3 to 4 millimeters. If we complete the picture, the carotid artery vessels are 5 to 7 millimeters, and the femoral arteries are 6 to 8 millimeters, so getting progressively bigger. It turns out that when you accumulate cholesterol or blockage in these blood vessels, it occurs pretty evenly throughout the body. But the small blood vessels are going to be affected first. So thus, erectile dysfunction often will predate any problems with the heart, neck, or legs. When we look at other good studies and ask about the timing of how well this predicts this phenomenon, a couple have shown that approximately 3 to 5 years after men first develop problems with erections, they can have their first heart attack. Now this is data out of the Mayo Clinic, Olmsted County, which is the county in Rochester, Minnesota, where our clinic is located. It basically looked at 1,400 men who at the beginning of the study did not have any problems with erections. Over the course of a 10-year follow-up period, some men developed what we call incident ED. That means they just developed it for the first time. After they developed erectile dysfunction, then they kept following them and wrote down whether or not they had any other events, including those related to the heart. This included sudden death from a heart attack, just a heart attack that didn't kill the person, or going to the emergency room for chest pain, for example. This study was quite impressive in that young men, ages 40 through 60, had this crazy increased risk of having a heart attack if they developed incident ED. You can look at this column here is the men who developed incident ED, and these are the ones who didn't develop ED, and you can see the relative risk of having a cardiac event was about 50-fold for the young men. It decreased to about 30-fold for men in their 50s, and then the relative risk decreased the older they got. Even when in the 70s, erectile dysfunction did predict heart disease, but not as strongly because as you get older, there tends to be competing causes for problems with erections, including medication side effects, etc. So overall, problems with erections at a young age is one of the strongest predictors of heart attacks that we have in modern medicine. But I don't want to overemphasize this risk because there's a lot of men, young men, who develop problems with erections because of performance anxiety. And we covered this in another video, but essentially if men are worried about getting erections, they will have problems getting erections. This is not going to predict heart attacks. The type of disease that causes erectile dysfunction that predicts heart attacks is one in which there's problems with arterial blood flow and blockage. And so a good predictor of who this person might be is a young man with a really strong family history of heart attack at an early age in like mom or dad, direct brother, that kind of thing. If that's in your history and you develop erections at a young age, you have to go see the cardiologist or primary care doctor to make sure that the heart is okay. So this begs the question, is sex safe? If we know that there's big correlation between these two conditions, is it okay to have sex? Well, Dr. Jackson, a cardiologist who died a few years ago from England, has a couple great studies. And essentially they say, one, sex for the most part only mildly elevates the heart rate, respirations, and blood pressure. And this is similar to light exercise. He goes on to say it should be routine policy to advise patients and their spouses on sexual activity, whether they've had an infarction or a regular attending with angina pectoris. That means they go to the cardiology clinic often complaining of chest pain. Most patients with ischemic heart disease can enjoy normal sexual relation without risk. So at the end of the day, sex is safe. It is possible to have a heart attack while having sex, but it's relatively rare, much more likely to trigger the heart attack with moderate to vigorous exercise, like shoveling snow, for example. So all in all, ED then should really signal not only erectile dysfunction, but endothelial dysfunction, which is a fancy way of saying problem with the blood vessels and narrowing. Early detection, I hope we got that point across. Exercise and diet, because any changes that you can make that affect the penis in a positive way also affects the heart in a positive way, etc. So please watch the video on lifestyle changes to get more details on that. And finally, erectile dysfunction can signal the risk for early death. The penis is essentially the canary in the coal mine. It predicts heart disease. And so you see a couple pictures here of a canary out in front of a big coal station. And then there's another picture here of a canary revival device, which I thought was pretty interesting. So what the coal miners used to do is they used to bring these canaries down into the mine shafts with them. And when the canaries stopped singing or died due to lack of oxygen, the miners knew it was time to get out of the mine shaft because they too were at risk of dying. So this device here, pictured in this picture, was actually designed to give emergency oxygen back to the canaries in case they did die, or pass out, I should say. So I like to tell patients that if your penis, like the canary, stops singing, it's time to go see the doctor and get your heart checked out. If you come to see us at Mayo Clinic in Rochester, Minnesota, we are going to make sure that your heart is safe. And we not only will treat you for the erections, but make sure that we screen for the proper things. So pictured here are two of my colleagues and friends, Dr. Scott Collins, Dr. Stephen Kopesky, both an internal medicine doctor and cardiologist, respectively. These guys will make sure that your heart is safe and will take great care of you as part of the Mayo Men's Health team. Well, thanks for watching. If you have any questions or would like to schedule an appointment with us, please call the number on the screen. Until next time, Toby Kohler signing off from Mayo Men's Health Moment.